you on Planetterrian Daily, episode 85 for June 10th, 2026. Let's get into today's research and health developments. AI analysis of normal mammograms can flag elevated breast cancer risk up to a decade before diagnosis. Retrospective data show rising AI scores up to 10 years before diagnosis in women who later developed cancer. The pattern also appears in a separate prospective analysis covering a 3 to 5 year window. The method uses routine mammogram images already collected in clinical care. Validation in larger cohorts is the next reported step. Now we turn from early detection tools to cellular mechanisms that may drive disease progression. Researchers identified an epigenetic regulator acting on microglial mitochondria. The pro-inflammatory state of microglia drives disease progression in experimental models. Targeting this regulator could alter mitochondrial function inside these immune cells. The finding opens a potential route for therapy or prevention. Work remains at the preclinical stage. Ancestral sequence reconstruction revives ancient enzymes by inferring protein sequences through backward tracing of evolutionary history. The method targets enzymes that may have performed optimally millions of years ago. Researchers apply the technique when modern versions fall short for biotechnology needs. The approach reconstructs sequences computationally before laboratory testing. No specific performance metrics appear in the post. Soft bioelectronics advance wearable and implantable sensors through work in Wei Gao's lab at Caltech. The lab develops stretchable, tissue-integrated devices. The sensors enable continuous monitoring and adaptive therapy. Materials combine softness and adhesion for long-term body contact. The work targets diagnosis and treatment across multiple conditions. No quantitative performance data are provided in the summary. Augmented reality ultrasound generates real-time 3D views through a system created by MIT researchers. The system renders live three-dimensional ultrasound images. The display overlays the volumetric data onto the patient's body. The design aims to simplify interpretation during scanning procedures. No patient numbers or accuracy metrics are stated. Clinical testing steps are not described. While disease mechanisms continue to be mapped at the cellular level, another study examines how everyday physiology responds to extreme endurance efforts. A review examined effects of marathon running on the heart. It documented release of cardiac troponin and NT-proBNP after races. These elevations occur without established clinical significance in most runners. The analysis draws on existing studies of endurance exercise physiology. Future work may clarify whether repeated biomarker spikes influence long-term cardiac structure. Theoretical models predict beta decay rates in neutron-rich nuclei through calculations developed by TU Darmstadt researchers. The rates influence models of heavy element formation in the universe. Calculations were compared with available experimental data. Results appear in physical review letters. Further measurements will test additional nuclei. From acute exercise responses, we shift to a behavioral intervention that may protect cognition during medical treatment. Cancer patients following a structured home program maintained better attention scores. The trial compared the intervention against a placebo condition. Low-dose ibuprofen produced smaller and less consistent cognitive benefits. Up to 80% of chemotherapy recipients experience chemobrain. The exercise protocol required no clinic visits. Glucosamine use tied to faster cognitive decline appears in a large observational study that linked the supplement to accelerated progression from mild impairment to Alzheimer's. Users showed a reported 25% higher likelihood of developing dementia. Biological measurements provided possible mechanistic clues. The association does not establish causation. Replication in additional cohorts is needed. Asexual reproduction slowed early animal evolution according to fossil evidence indicating Earth's first animals reproduced asexually. Low competition communities limited morphological change over long periods. Environmental pressures later favored sexual reproduction. Biodiversity and evolutionary rates increased sharply afterward. The study draws on paleontological records. Staying with interventions that support brain health, our next segment examines how breast milk composition aligns with newborn brain development across species. A multi-university study compared fatty acid profiles across mammals. Humans showed the strongest alignment with prefrontal cortex development. The composition varies systematically between species. Findings support efforts to engineer infant formulas closer to human milk. The breast milk fatty acid study reveals species-specific tailoring that aligns most closely with human prefrontal cortex needs. This compositional matching likely supports rapid postnatal brain growth unique to our lineage. The work supplies concrete targets for formula development rather than generic nutrient lists. Global Commission targets brain health as economic driver through the Brain Health for Economic Resilience Commission, which will define and measure cognitive capacity. It frames brain health as a foundation for economic resilience. The effort is transdisciplinary and international. Nature Medicine announced the initiative in a recent comment. Specific metrics and timelines are not yet detailed. From early life nutrition to built-in patterns that shape everyday movement, we look next at a surprising directional bias in human walking. Researchers in Spain and Japan tested people walking in varied group sizes. The vast majority preferred counterclockwise turns, regardless of culture or gender. Age produced a small difference, with younger participants showing the pattern more consistently. The study measured turning behavior directly during natural movement. No external factors overrode the directional preference. Most people assume their direction choices while walking are random or shaped mainly by culture and habit. In reality, humans carry an inherent bias toward counterclockwise turns that appears across tested populations. Right now, as you navigate a hallway or sidewalk, that same directional preference is likely influencing which way you veer when space opens up. The studies found the pattern held in groups of different sizes and showed only a modest weakening with age. One memorable detail is that the vast majority of participants followed the counterclockwise rule, regardless of gender or background. The next time you observe crowd flow in a public space, notice whether the collective drift matches this built-in tendency. Researchers can now design clearer experiments on navigation aids or building layouts that either work with or against the bias. Neolithic burials revealed dozens of headless skeletons uncovered by archaeologists in southwestern Slovakia. The skeletons date to approximately 7,000 years ago. Evidence indicates deliberate burial after death. The pattern may reflect a specific Neolithic mortuary practice. Further analysis of the site continues. Development displaces millions of amphibians without follow-up, according to UBC researchers, who documented more than 5 million amphibians and reptiles moved in British Columbia over 4 years. No legal requirement exists to track post-relocation survival. The study is the first to quantify the scale of such relocations in the province. Data come from development permits. Long-term outcomes remain unknown. Before we go, keep an eye on further validation work for the mammogram AI tool in larger cohorts. That's Planetterrian Daily for today. If you enjoyed this, a rating or review on Apple Podcasts or Spotify really helps new listeners find the show. I'm Patrick in Vancouver. Thanks for listening, and I'll see you tomorrow. And before you go, this show is part of the NARA Network, a family of daily podcasts covering tech, science, markets, and more. If you enjoyed today's episode, give Models and Agents a listen, your daily briefing on AI models and agents. You can explore the whole lineup at naranetwork.com. This episode used AI voice synthesis of my voice. Editorial selection and analysis are my own.